First up, let's get you the latest figures that have been put out by the government on the number of COVID-19 cases in India. It's now breached the 20,000 mark. The total cases in India now stands at 20,471. The death toll, unfortunately, has now risen to 652. We're also breaking down the state-wise data for you. Maharashtra remains the worst affected with 5,221 cases and 251 deaths. The number of cases in Gujarat has considerably increased and it's now standing at 2,272 with 95 deaths being reported. In the national capital, the number of coronavirus cases stands at 2,156 and 47 deaths have been reported so far in Delhi. Those are the latest numbers as of 6:30 this morning. Here's also a look at the top 5 developments that you need to know on the coronavirus crisis. 11 members of a family in Delhi's Jama Masjid area have tested positive for coronavirus. A 12-year-old is among the infected members. A family member who had travel history abroad had earlier tested positive. 3 are undergoing treatment at Delhi's LNJP hospital and the remaining are quarantined. Delhi's reported 92 new coronavirus cases on Wednesday. Gujarat has reported 229 new cases in the last 24 hours. Total coronavirus cases in the state have crossed the 2,200 mark. Ahmedabad is the worst affected with over 1,500 cases. 13 fresh deaths have also been reported in the state. In the wake of the coronavirus crisis, the Assam government on Wednesday instructed all private schools in the state to reduce fees for the month of March by 50%. The government said that educational institutions who have already collected fees for April will adjust the concession in the next installment. The Odisha government on Wednesday said that there will be no mass prayers and or iftar gatherings at any mosque in Bhubaneswar during the holy month of Ramzan, which begins from April 24th. Religious gatherings are already banned under the lockdown norms in the country. Odisha so far has 82 coronavirus cases. The Jammu and Kashmir administration has withdrawn its earlier statement on cancellation of the Amarnath Yatra this year due to coronavirus. Officials have issued a new statement saying the situation will be reviewed in the coming future. The holy pilgrimage is scheduled to take place from June 23rd to August 3rd. The state of Maharashtra remains on edge as the coronavirus cases continue to rise in the state. Maharashtra is the worst affected state in India and has reported 431 new cases and 18 deaths on Wednesday. This takes the total number of cases to 5,221 in the state with 251 deaths. The financial capital Mumbai reported 232 new cases and 10 deaths yesterday. Amid the surge in cases, the State Health Minister Rajesh Tope has claimed that the doubling rate in the state is now down to 7 days. He said that the state has got permission to use plasma therapy. He also said that the hotspots in the state are down to 5 from 14, which includes Mumbai, Nagpur and Pune. The state minister announced that 83% patients in the state are asymptomatic and 13 are getting discharged every day.
आपण प्लाझ्मा थेरपीमध्ये आपण मुंबईमध्ये पूर्ण प्रयोग करण्याचा निर्णय घेण्यात आलेला आहे की ज्यामध्ये बरे झालेल्या पेशंट्स आहेत त्या बरे झालेल्या पेशंट्सचे आपण त्याच्या जे अँटीबॉडीज आहेत त्या अँटीबॉडीज काढून म्हणजे त्यांच्या प्लाझ्मा काढून त्या क्रिटिकल पेशंट्सला देण्याबाबतची जी काही प्रयोग करण्याची आपल्याला मुंबईमध्ये परवानगी ICMR ने दिलेली आहे.
Divyesh is joining us live from Mumbai this morning with all the latest updates. Divyesh, good morning. Going by what the state health minister has said, you know, we're very worried with the kind of numbers that are coming to light from the city of Mumbai and Maharashtra. But he is saying that the doubling rate has come down. So is there some sort of silver lining? Are all the steps that are being taken by the authorities actually working on the ground?
Good morning, Akshita. The numbers have been rising in the financial capital in Mumbai and in the state as well. As of now, we see that there are around 5,649 active cases in Maharashtra and there are around 3,683 cases in Mumbai itself. There are around 465 containment zones and government is trying every possible bit so that the numbers, the community spread could be stopped. The highest concern, the biggest concern of authorities remains slum pockets like Dharavi, slum pockets like Govandi, Worli-Koliwada. Worli-Koliwada has showed some promising results, while Dharavi, the numbers keep rising. The numbers have risen to over 167. So these are the containment zones. These are the areas where Maharashtra government has deployed extra forces, deployed extra health workers, additional health workers are screening. More and more screening is being done. Also, the central government team visited Dharavi, and they have given certain advisories on how the containment zones to be tackled, how the community spread could be tackled in these areas. Akshita?
Okay, Divyesh, thank you for joining us with those details. Clearly, as far as the authorities go, their focus is going to be on containing the spread of coronavirus in the slum areas of Mumbai. Now, an inter-ministerial team from the centre also visited Mumbai to assess the situation, particularly in Dharavi and Worli-Koliwada. Maharashtra Health Minister Rajesh Tope was seen accompanying this team. India Today tracked the inside details of the centre's assessment of the COVID outbreak in Mumbai, and we get you details in this report.
Inter-ministerial central team at Mumbai's Dharavi virus hotspot. Asia's largest slum with 8.5 lakh residents remains a massive challenge.
We are in Dharavi right now, and in an important development, a 5-member inter-ministerial central team has been formed for Mumbai and Pune. One such team that has been formed is visiting the Dharavi area right now, collecting information which will form the basis of the final report, which will then be submitted to the central government for further concrete actions.
Despite unchecked spike in cases, the state government remains hopeful.
क्लस्टर कंटेनमेंट स्ट्रैटेजी का जो प्रोटोकॉल है वो फॉलो करना, यही मुझे लगता है सबसे इम्पोर्टेंट काम होता है. ये हम काम कर रहे हैं. खासकर क्वारंटीन फैसिलिटीज बढ़ाने का काम हम धारावी के लिए स्पेशली करेंगे. मैंने कमिश्नर को बोला हूँ, यहाँ का कंटेनमेंट स्ट्रैटेजी एग्जैक्टली फॉलो करना, जैसा कि भाई यहाँ के जो भी हाई रिस्क कॉन्टैक्ट्स है उनको आइसोलेट करना, यही सबसे बड़ा चैलेंज है.
Scant social distancing in the densely populated zone, resistant face and screening drive, and moving out high-risk contacts remain big stumbling blocks in Dharavi. Dharavi can learn a thing or two from Koliwada. Home to 40,000 fishermen, the area has arrested the spread through mass screening, sealing, containment, and regular disinfection drives. From 50 cases a day, Koliwada now sees a slump in cases and rise in those getting cured.
यहाँ पे जो सोशल डिस्टेंसिंग है उसका पूरी तरह से हम लोग पालन कर रहे हैं. और जहाँ तक डॉक्टरों का सवाल है, यहाँ पे वैसे डॉक्टर वगैरह आ रहे हैं.
वर्ली-कोलीवाड़ा में जिस तरह से सरकार ने और पुलिस ने जिस तरह से यहाँ पे जो काम किया है, वो काम के लिए मैं सरकार और पुलिस दोनों को धन्यवाद करती हूँ.
Officials are still worried about the conditions in Dharavi, whereas the conditions in Mumbai's first containment zone, that is the Worli-Koliwada, is improving. The number of cases being reported are decreasing, whereas more and more people are getting discharged. Many people are being screened door to door.
Can the Uddhav Thackeray government replicate Koliwada model in Dharavi? Bureau Report, India Today.
And Prime Minister Narendra Modi will hold a crucial review meeting with chief ministers of all states. This is set to take place on April 27th. Sources said that the Prime Minister will review the COVID situation in the country and will seek the feedback of chief ministers. With cases multiplying every single day, there is a strong buzz that the centre may go for a third phase of lockdown from May 3rd. Sources indicate that some state governments are also analysing the situation on their own. Telangana has already, of course, extended the lockdown till May 7th, while Delhi is also mulling to extend the lockdown. Sources said that states like Maharashtra, Gujarat, Rajasthan, Tamil Nadu and Uttar Pradesh are also not very confident of ending the lockdown due to the spread of the virus in parts of these states. So on 27th April is when this meeting will be happening, where Prime Minister Narendra Modi will be interacting with chief ministers, no doubt also seeking their opinion on what they think the strategy should be post May 3rd. So are we going to be seeing the lockdown extended perhaps in a more phased manner, or is there going to be some sort of decision on exactly how to lift the lockdown? In states like Maharashtra, there is going to be a big question mark on whether we can afford to lift the lockdown at all come May 3rd. Several states have already taken the decision that they're going to be extending the lockdown. The likes of KCR has already announced that till May 7th, there will be a lockdown in Telangana. Rahul Srivastava, National Affairs Editor, is joining us this morning with more details on this. Rahul, good morning. You know, this particular meeting will be very, very crucial. It's set to take place on April 27th. There's no doubt that a lot of chief ministers, Rahul, will be of the opinion that the lockdown must be extended, considering that the number of cases are still on the rise in states like Maharashtra and Gujarat and even in Delhi.
Good morning. Yes, it's an extremely tricky situation. I think all chief ministers and the prime minister and the central government face. You see, it is one very critical element is that when I was speaking to some senior leaders in the government, both at the center and state, and they were saying that it is a strange perception that it is the government which is actually requires a lockdown, not the public. The quality of the adherence to the lockdown perhaps will determine few things like whether the coronavirus spread curve will get flattened or not. And that flattening is perhaps critical to any kind of relaxation as far as curbs are concerned. What most leaders are saying that already, though the government may have, central government may have extended May 3rd, chief ministers have already kept a margin of even May 8th and 7th. And that is why when already chief ministers are in a mood to keep the restriction longer, the centre may not have a role to play in it. The other element is that nobody could think that restrictions are going to go suddenly after May 3rd. There is an opinion that a lot of restrictions, social distancing norms, containment, other elements will remain. It's a very risky situation the government is facing at this moment, because India is at a point where either the curve can get flattened or there could be a certain amount of spike as far as the cases are concerned. And if we notice that those certain amount of restrictions have been eased as far as business activity and others are concerned, there is still a sense of worry even among those who now have certain relaxations, that how can they start back as far as economic and other activities concerned. And that is why the May 27th meeting, April 27th meeting will be critical, because there will be just 1 week left ahead of the extended lockdown. And by the time chief ministers and the central government and others may have a very critical view on where does India stand. And I think, again, I will say that it's just 1 more week to go. And I think how well Indians stick to social distancing, and I think the lockdown perhaps will decide how severe the extension or the life after lockdown after May 3rd may be.
There's no doubt that perhaps there's going to be a very staggered exit from this lockdown, but the government also faces a problem in the sense that they have to think about the resumption of economic activity. That also is a serious concern that they must address immediately. For the moment, Rahul, thank you so much for joining us with your perspective on this story. Now, News Director Rahul Kanwal also spoke to renowned virologist Dr. Ian Lipkin on the importance of the lockdown and how it can control the spike in the number of cases. Here's an excerpt of that conversation.
How long do you think this lockdown in India should continue? What kind of a re-entry strategy would you advocate? As you rightly said, people are now beginning to get frustrated. They've been locked up for more than a month. Many of them in small shanties, in slums, living 8 to 10 in a very small room. There's a limit to how long they can physically endure that. What kind of a re-entry, easing of the lockdown strategy, Dr. Lipkin, would you advocate for India?
So I think that it's impossible for me to tell you a date where you can begin to ease up. What you need to do is you need to assess with epidemiologists whether or not you have flattened the curve, the increase in cases, the increase in mortality, which lags by a week or so, the increase in the number of cases. You need to galvanize those people, who are in your biotech industries, who have the ability to develop personal protective equipment like masks and gloves, as well as testing equipment. if you consider testing on a wide scale, and you can identify clusters of disease early on, then you can just isolate those people and you can begin to move us all back to work, back to school, back to normal life. But there are some things that are going to be difficult and that will lag. So large public events, sporting events, theaters, movies, these kinds of things, very, very difficult, because close proximity of people is how this virus thrives. But I think you're going to be able to get back to a situation where people can at least get into jobs as long as they protect themselves appropriately with masks and gloves and try to get some sort of physical distancing. If you're living in a house with 8 people in a very small area, this is going to be very, very challenging.
But when do you think people can go back to the movies? When can they go to a restaurant? When will life, in your view, Dr. Lipkin, come back to the way it used to be before this virus just forced us to hide in our own homes?
When we have a vaccine. Before that, it's going to be it's going to be a series of compromises. So what we have right now is not tenable. It is not sustainable. We recognize that. So what we have to do is find a way to make it possible to find some kind of middle ground. And to move toward that middle ground, we're going to need more testing, more epidemiologists who can actually track new outbreaks. This is how smallpox was eradicated. And the last cases, as you know, were in India. So you have the situation where you would identify a case, you would vaccinate everybody around this case, you would isolate them to make sure that nothing went any further. This is going to be the kind of approach that we're going to have to this particular virus. We may wind up, for example, in a vaccine strategy when vaccine is in short supply, before it really gears up, where we may have to find cases and isolate contacts again, just as we did, decades ago. I hope not.
And a day after ICMR halted the use of rapid antibody test kits for COVID-19, the government is now focusing on a plan B, which is using more of indigenous testing kits. The government will also begin focusing on developing testing kits under the Make in India initiative. South Korean company SD Biosensor has started production of test kits from its Manesar facility, which has a capacity of producing 5 lakh testing kits per week. ICMR and CSIR are already working and developing their own testing kits. Meanwhile, the ICMR is also evaluating reports from states on faulty test kits. Earlier, India received 6.5 lakh testing kits from China. Several states had complained of the kits giving false results. And coronavirus politics, once again the focus in West Bengal as Chief Minister Mamata Banerjee has hit out at the central government for providing faulty testing kits to the state. Expressing concern over the future of COVID-19 tests in the state, Mamata Banerjee claimed that Bengal had 0 testing kits as on April 22nd. Mamata also accused the centre of creating a health hazard, saying it was crucial to conduct COVID-19 tests in time. Soon after, Chief Minister Mamata Banerjee lashed out at the centre. The West Bengal Health Department issued a statement saying that the state has been supplied with 0 kits that can be used to carry out COVID-19 tests as per ICMR recommendations.
বেঙ্গলকে বদনাম করে আমরা আমাদের সাধ্যমতো আমাদের হেলথ ওয়ার্কাররা থেকে শুরু করে সবাই কাজ করেছে, যেন খুব খুশি হতো যে বাইরে থেকে অনেকগুলো করোনা এনে ছেড়ে দিতে পারতাম, এরকম একটা অ্যাটিটিউড করেছে। আর বাংলার নামে পুরো ন্যাশনাল চ্যানেলগুলোকে কন্টিনিউয়াসলি বলে বেরিয়েছে যে বাংলা করছে না করছে না করছে না। দ্যাট ইজ নট কারেক্ট। দেখুন, র্যাপিড টেস্ট কিট, টেস্টিং কিটস যা পাঠিয়েছিল সব উইথড্র করে নিয়েছে। কেন? উইথড্র করার জন্য অ্যাডভাইজারি এসছে, তার মানে যা দিয়েছিল তার টোটালটাই উইথড্র। তার কারণ ডিফেক্টিভ। কার দোষ? 2, বিজিআই আরটি-পিসিআর কিটস, 3 রকম কিটস হয়, জেনে রাখবেন। আমরা তো এক্সপার্ট নই, আমি হেলথ ডিপার্টমেন্ট থেকে যেটা পেয়েছি, একটা হচ্ছে র্যাপিড টেস্ট কিট উইথড্র, পুরো একদম ফল্টি, 2 হচ্ছে BGI RT-PCR kits. These are being also withdrawn. কে মিস্টার রাজীব সেনা? Yes. These are being also withdrawn. তারপরে 2 রকম কিট চলে গেল। এবার 3 নম্বর কিটস, অ্যান্টিজেন কিটস। এটা আমাদের বাংলার হাসপাতালে পাওয়া যায় না, নেই। তাহলে কিটস থাকলো কোথায় হাতে? আমরা করিনি বলে যারা মিথ্যে কথা বলাচ্ছিল তাদের জিজ্ঞেস করুন, উত্তর কে দেবে?
There are still doubts over whether the T20 World Cup will eventually happen or not. But Vice Captain Rohit Sharma is ready for the challenge should the opportunity come. Here's an excerpt of the conversation that we had with Rohit Sharma.
Whenever cricket comes back, there is a T20 World Cup that's supposed to happen. I don't know whether it will happen in October or November or will be next year. Do you think whenever it happens, we in India, I mean the team that you have, do you think this can become a problem, the fact that you all are staying away from cricket, or it's the same everywhere? And do you actually think that whenever this team comes back, India will be in a position to give a real crack for that title? There will be this extra incentive coming back to sport after a period of time?
Yeah, I mean, see, winning the World Cup is a dream. It's a dream of all of us together. I want to win World Cup. I want to win World Cups. I'm really like, yes, of course, every time you go out there to represent your country, you want to win every game. But World Cup is something that, you know, is the pinnacle of everything. So I want to win World Cups. And this time, I mean, we're really not sure when this World Cup is going to happen, but as in whenever it happens, you know, we will have a fair amount of time to prepare for it. I'm pretty sure that, you know, the cricket boards around the world are not just going to say, okay, everything is fine, we will just schedule the World Cup. Of course, there will be preparation time that will be given to all the countries, because all the countries are under lockdown. Nobody is playing or nobody is practicing, nobody is training, besides staying in home and doing limited stuff. And that is not enough. You know what I mean? I mean, you need to go out there in the gym and start training and get into that routine, get your muscles strong, especially for me, because I was injured before all this happened. So I have a lot of work to do before I start playing. I was just around the corner to do my fitness test until the lockdown happened. So the first thing for me would be to just go and do the fitness test and pass the fitness test, and then obviously hit some balls, because it's been a while. The last ball I played was 2nd Feb. You know, it's been a while. That is the day I got injured. So it's been a while for me. So I'm quite looking forward to go out there and play and do what I love the most. And I'm sure it's the same for all of us, all the cricketers.
And with that, it's a wrap in this edition of the Bulletin. For all the latest news and updates on coronavirus, you can log on to our website, indiatoday.in. Do also download the India Today app. We hope you're staying home, staying safe.